IV insertion and removal. Start by showing up fully dressed. And you're going to check your hospital policy and order form. Identify the patient using two patient identifiers. I'm going to use Jaguar Jones and his date of birth 8/25/1963, checking both the order form and the patient's band. And I will also check for allergies, both on the form and at the bedside, and ask the patient if there are any allergies not listed. Introduce yourself to the patient and let them know what you're going to be doing today. Gather all supplies and perform hand hygiene. Going to move my trash can to a comfortable spot, and again perform hand hygiene. Going to now open all kits using aseptic technique away from me. Next, I'm going to perform hand hygiene again and don goggles. I will now raise the patient's bed to a comfortable working height and lower a side rail. So some principles for picking a vein. You are going to find a large, bouncy, spongy vein. It's best if it is in the non-dominant arm and you want to be as distal as possible. Principles for fostering venous distension are going to be applying warmth to vasodilate for several minutes. You can stroke the veins lightly and put the extremity in a dependent position and have the patient open and close their fist if they are able to. So next I'm going to do my saline lock. I'm going to start by picking up my J-loop and I'm going to cleanse the port with an alcohol swab. I'm going to cleanse the whole port. And I'm now going to take my syringe and first I'm going to make sure that the saline comes out and secure it. While I have my J-loop, I'm going to also loosen this cap so when I do connect it to the IV, it's easier to connect. Also, before I get started, I'm going to get a couple pieces of tape ready for stabilizing the IV later. Now I'm going to apply the Trichoderm. This is going to go 4 to 6 inches above the site that I've picked, and I'm going to tie it pretty tight with a slip knot. If you need extra time, you are going to want to let the Trichoderm loose. So I'm going to perform hand hygiene and place on clean gloves. Next, I'm going to cleanse the site that I have picked with the chlorhexidine, and it comes in the IV starter kit. So you're just going to push down on the wings and it will release the chlorhexidine. The site that I'm cleaning, you want to clean in a vertical motion, then a horizontal motion, and then lastly a circular motion. And you need to clean for at least 30 seconds. And normally you would let that site dry, but for time's sake, I'm going to go ahead and move on. So you do want to have your J-loop as close as possible while maintaining sterility. I'm going to take my catheter, take the cap off, place in the sharps container. Now I'm going to hold my needle and catheter with my dominant hand, and I'm going to pull the skin back where I've just cleaned, not touching where I clean. And with the bevel up, I'm going to insert at a 10 to 30 degree angle, not allowing the needle to touch my thumb, holding back the skin. And I will wait for blood return. Once I've seen blood return, I'm going to insert another 1/4 of an inch. And then from here, I'm going to only push in the catheter all the way to the hub, not extending the needle anymore. And while the catheter is secured with my right hand, I'm going to release the tourniquet with my left, place pressure 1 1/4 inch above, and remove the needle and place in my sharps container. From here, I'm going to secure my J-loop, aspirate for blood return, and inject the saline solution. For the sake of my noodle, we're just going to pretend that I've injected the saline. Going to remove the saline syringe and put it in the sharps container. And then we are going to temporarily secure the IV with a piece of tape. Next, I'm going to secure the IV with the Trigoderm. Going to start by taking the peel off the back, and there's a slight slit that's going to go over the hub, so I'm going to just place that over the hub of the IV, take off the edge, and I'm actually going to keep this because it has my label on it. Next, I'm going to remove this temporary piece of tape we had. When you're removing the tape, just make sure it's not pulling on the J-loop. And next, I'm going to secure the J-loop, so you can see it's kind of just forming its own J naturally. So I'm going to just secure it where it naturally lays. And the last thing I'm going to do is take my label. I would put date, time, and my initials on it. And this will go on the side, the Trigoderm film cover. So from here, I would just inform the patient that they need to let me know if they have any inflammation or phlebitis. Just teach them the signs and symptoms of that inflammation. Let them know to let us know if their fluids stop or they see blood in the line. And finally, to protect and guard their IV when moving, getting up, and it needs to be wrapped when they are taking a shower. Next, I would remove my supplies. I'm going to assist the patient to a comfortable position, lower their bed, raise the side rail, remove my gloves. And at this point, I would be finished inserting the IV. I would move on to documentation. In documentation, I'm going to document the size, length, and type of catheter I put in. I'm going to put the site or location of the IV, if they have any IV fluids, the patient tolerance, and the date and time for it. Next, I'm going to perform removal of the IV. So again, you would come in, check the order form, identify the patient and their allergies, introduce yourself and explain what you're doing. I would, of course, perform hand hygiene, and I'm going to go ahead and prepare a piece of tape for securing the gauze after the removal. Going to perform hand hygiene again and put on clean gloves. And I still have on my goggles, but if not, it's a good idea to put on your goggles. Okay, now that we've finally got that. So I'm going to place a waterproof pad underneath again, just in case there's any blood loss. Okay, and I have my 2x2 gauze ready and my piece of tape. So the first thing I'm going to do is begin removing the trichoderm, and you're going to remove it towards the site. And also remove the piece of tape securing the J-loop. Maybe. Next, I'm going to take my 2x2 gauze and put it over the insertion site, apply pressure, and remove the catheter parallel to the skin. Before I discard the catheter, I am going to check for intactness, and then I'm going to place it in the sharps container. It may be important to apply pressure for an extended amount of time, especially if the patient's on anticoagulants. But once you have applied pressure for long enough, you're going to secure that gauze with a piece of tape. and then they should be good to go. So you remove that waterproof pad, and again I'm going to assist them to a comfortable position, lower their bed, raise the side rail, remove my gloves, and document the removal of the IV and the stopping of the fluids and the intactness of the catheter. And that completes IV insertion and removal.